just kind of start by.
Yep.
I've been advocating for health, especially men's health, for a long time. In my own life, these last few years have been definitely working on weight loss, keeping my numbers where they need to be, talking to my primary healthcare provider. So doing the things that I was supposed to do. I believe it was March when I had the men's event.
Yeah.
We had a great time with that, and we dealt with mental health and physical health with that. So I'm usually keeping up with my personal health, understanding my family history. So I try to keep up with that. But for those of you on, Shanice, Rashida, Gwen, hi everybody. Those of you on, I appreciate
Yolanda.
you. Yolanda. I'm not going to go through and share our story, and we'll talk about it. And whoever catches the replay will catch the replay.
Yeah.
But in the end of November, I kind of had some trouble breathing. And I went to my doctor, went to the urgent care, got breathing treatments, and felt better after those breathing treatments. So that's the end of December, having some breathing problems. No sign as of before, but started having it. So I went to my primary care doctor, I went to the urgent care, getting breathing treatments. That helped a lot. They also referred me to a certified allergist to find out what's going on with if there's allergies or if there was asthma. And they kind of thought it was asthma at first. I questioned that a little bit. I was like, I'm developing this at a late stage, a late age, getting asthma. So I kind of questioned that. It gave me a lot of inhalers and things of that nature.
And a nebulizer.
Nebulizer. At the end of it, finally getting a nebulizer, but still none of those things helped. And then it got to the point where I said I need to go to the doctor. So Rhonda, it was kind of, we both, she was just with me dealing with that, and she said, kind of telling Ron, he's like, we have to go to the doctor tonight.
Yeah, so as he stated, all of this preliminary stuff started about November. Jay has been very intentional about health, eating, exercising, etc. But in November up until about April, Easter Sunday, he'd been struggling here and there periodically of breathing. And after tons of doctor visits, ER visits, he would always feel better, and then it would come back up in a different form. So with the progression of all of that, on Easter Sunday, I noticed that he started to breathe a little bit more with labor, and that he was not already sleeping well at nighttime. He'd get up and then go sit up in the living room because he said it was a little easier to breathe sitting up. With me trying to understand the whole path and figuring, okay, well, if it's better him sitting up, then you just have to sit up. But it progressed from just sitting up and not being able to sleep at night. It progressed to him coming home early from work, very fatigued, very tired, wanting to lie down. It just started to exacerbate in a way that I thought was a little weird. So we get through Easter Sunday. I wanted to go with him then. Just so I could see, because at this point we hadn't explained or expressed to anybody the difficulty of him breathing in between the time. So we just didn't want to, we're going to the doctor. We're praying. We're trying to figure out what's going on. So we're doing something. We don't have to literally make like an announcement. All right, that doesn't need to be an announcement. That's generally not how we are. So we just kept going to doctors. I would question their diagnosis. What do you mean he has asthma? What do you mean? Nothing is going on. We can't really see anything. Just asking questions to see kind of where they were and not just accepting what they had to offer us. We still were just not really satisfied with what was going on. That being said, the following Sunday, to get up, getting dressed even to go to service, buttoning his shirt, even more labor than I had ever seen it before. and he was adamant to go to service. I was still very concerned, but he was like, I'm just gonna go sit on the side. I'm not gonna do much of anything. I just want to go, and then I'll come straight home. Fast forward, he comes home from service. It's worsened in my opinion, and he's sitting at my counter at the kitchen counter, and he just kind of postured and bracing himself on the counter. I wasn't satisfied. I said at that moment, we're not sleeping tonight. Nobody's going to sleep tonight. We're not going to do this another night. We have got to go back to the doctor. We have got to get an answer. Again, we were searching answers all of this time. Wasn't quite satisfied, but we were pleased that we were consistent in trying to figure out what it was. And because we had spurts of, okay, it's working, and then it's not working, this was like the end for me. I was just like, we're not going. So we get to the hospital. One of the questions Jason wanted to know was, where are we going? I said, we're going to MUSC. We go there, and I know there's protocol, but I was very intentional in saying, we don't need to check his temperature. He does not have a fever. We don't need to check his knees for reflexes because his knees working fine. He can't breathe, and I need to figure out what's going on. I let them know at that point we did not want any prescriptions. We were not going to go home with another nebulizer, with another inhaler. I was at that point, either you admit us or we just going to sleep in the waiting room because we're not going home. I was very intentional about that. So fast forward, one of our concerns initially from the very beginning and going to the doctors continually, we wanted to make sure that he did not have pneumonia. Because there were some times that we would hear a bit of what we thought was what we call wheezing. And they would always say, oh, no, it's not pneumonia, it's not pneumonia. By the time we get to the emergency room on that Sunday, they say, oh, you have pneumonia. But not only do you have pneumonia, you have a lung infection because there is fluid on your lungs. So much so on the right side more than the left. But they were very, very stern in saying if he went to sleep, he could have just literally drowned. So I was like, what does that mean? But I've come to find out that with the fluid collecting so much and at the capacity that the fluid had collected on his lungs at this time, if he went to sleep, he literally would have drowned in his own body because it just would have been too much fluid. He would have been not able to breathe in and get the air that's needed. So the fluid would have suffocated all the air for him to breathe, and that was extra scary. We get admitted, and then once we get admitted, I am a little bit relieved because I'm like, well, this is not the answer that we're looking for, and I'm still confused as to how he has pneumonia and a lung infection because prior to this, our last appointment was about less than 2 weeks, or right at 2 weeks before this, and they had just said he didn't have pneumonia. So I was like, what do you mean he has pneumonia and all the things? But I was a little bit relieved because now we're at the hospital, now he's admitted. They started administering antibiotics and fluid and just all the things right away. They gave him medicines to get rid of the fluid in his lungs because another thing that we noticed is that he started to cough. It wasn't phlegm, but it was liquid. We found out later that that was probably his body's natural way of trying to expel some of the fluid from his body. That only happened like twice, and then he was okay. But at this point, by day 2 or so, he looks better. He looks a little bit renewed, revived in his face. He didn't look so weary and tired. So I'm thinking, okay, this is going to go. So we go Sunday, we go Monday, we go Tuesday, and Wednesday morning, the same patterns. They hadn't given us any indication of a discharge at this time. They're just like, we're kind of looking, we're just making sure. And up until this point, the medicine that they gave him to expel the fluid and help him get rid of more fluid so he wasn't holding, that was working. Again, his facial, everything was looking like rejuvenated and revived. So I'm like, okay, this is good. But he gets up on Wednesday morning, eats breakfast as normal. He is around lunchtime or so, and he expressed that he was a little tired. Not too surprising, because throughout this time, like I said, his energy level was very, very low, just kind of tired, and I thought, maybe it's just a recuperation. He's gone through a lot. This is a lot. The lung stuff, he's getting better, but he's just tired. No big deal. But all this time that he'd been in the hospital, every day, I committed myself that one, I was not going to leave the hospital. We were going home together. So that was the first thing. The second thing is I take very seriously when people say they don't feel well. I want to stop right here and just say this and encourage this. If someone around you that you love and care for says that they are not feeling well, it is not a take a Tylenol, drink a ginger ale kind of moment and take some rest. Like literally listen to what they're saying and pay attention, because I'm very intentional about paying attention to what somebody is doing if they're not feeling well. Don't just take it so lightly. In this case, it literally was a contributing factor to saving his life. So every time that he went to sleep, even though we were in the hospital, I don't have any nurses, doctorate, anything, but I'm a wife. I'm paying attention to what's going on. And so every time that he would go to sleep, I would pull up a chair next to the bed to watch him, just to kind of look at his breathing patterns, just very intentional on watching what was going on with him. And on this day, on this Wednesday, as he went to sleep, all he said was, "I'm tired." He went to lie down. He went to go lie down, and as I was sitting up in the chair, he took a breath that I thought was very odd. He had never taken in a breath that way. He did not moan. He did not ask for help. He did not look like he was in distress. But what I can tell you was when he took a breath that I thought was not normal to what he normally would do, I got up. And by this time, because we'd already been in the hospital since Sunday, we make friends pretty easily. The nurses and the doctors, and so they know who we are at this point and are ready to assist us in any manner at this time. So we're there, and as I'm getting up, the lady that was at the nurse's desk, which is another grateful point I want to stop to make, the nurse's station happened to be directly across from where our room was. And so as I was getting up, the nurse at the desk, she was getting up at the same time. I guess looking at my face, I don't know what it was. He wasn't hooked up to a whole bunch of stuff at this point, but I guess she got up because it looked like something is going on with me. So she gets up and she comes out. I'm explaining to her, listen, something's going on. I didn't know what was going on at that point. They come in, and before you know it, there are tons of people in the room. Like over 10. They're in the hallway, the room, they're just there. We didn't get the words and did not hear the word stroke at the time. They got him. They took him away. He was gone for quite some time. I am in the room like struggling because Jay's always been a strong man, able to move, breathe, and do everything on his own. And he just looked really weak and frail. And I'm scared at the point. I'm sure that he was scared as well. And then eventually, time passes. They bring him back, and they bring him back to me like, "Oh, we're fine." And again, we hadn't gotten to the verbiage of stroke at this point. We hadn't even got there yet.
And I felt fine when they brought me back the first time. Now, mind you, I had X-rays. At the first time, I went to a different hospital in December. I had X-rays and things of that nature. Because I was concerned with the breathing. I was like, I want to make sure I don't have pneumonia.
Right.
I was very concerned with that, but everything was fine. But with everything we're doing preventative, the problem kept coming back.
Yeah.
And so that's why we said, okay, we have to go to the hospital now. So, I wasn't doing well. Rhonda was like, something's wrong. They come take me out for a while. When I come back, I feel like I'm fine when I come back.
Mm-hmm. And at that time that he comes back, I'm relieved because I'm just like, I don't know what's going on. I know that they're going to explain what's going on. I was just happy, that we're in the hospital while whatever is going on, they'll give me information. It'll still be fine. When Jay comes back in the room, he does look a bit settled, but my mother-in-law was actually in the room as well. And when he came in, the lady was standing at the door. Some other people have been standing in the hallway. I assume they're about to brief me on what just happened and what's going on. Before we get to that point, I look at him and I say to Jason, "Babe, I'm here. Everything's going to be okay. Don't worry about it." His response to me almost immediately was, "Yep." But the issue was he wouldn't stop saying yep. He kept saying yep, yep, like that. And by the time he said that second, third yep, I was up again. I said, "Nope, that's not it." And this time they rushed him out again, even more people. And this was chaotic at this point. Because, again, we had not heard the verbiage of stroke at this point. So I literally have no idea. He wasn't in the room a good 5 minutes before he had to go back out again. And this is the whole second episode that was much worse. This is when he gets admitted to ICU. I am literally losing it. Between the hall, the waiting at this time, I got enough strength to call for my children. I was just trying to get information out that way. I couldn't think of too many people to call because at this point I'm just like, my husband, the person that I know and move the way that he does, is able to do it. And it was very stressful, very scary, all the things at the time. And so they come back and they finally let us know at this point that the episodes were stroke related. This is the time when, if it were somebody else, to be honest, I would have been like, we're here, we're praying for you, we're doing all the things. I didn't have the cognitive ability at that point to go straight to that. I have to be honest. I finally got there, but my initial was, oh my God, like, we got to get Jay help. Oh my God, what is wrong? Oh my God, this is not normal. We finally got there. And again, I am positive this would have been scary. I don't think Jay may have been in the cognitive ability at that time to know exactly what was going on. But to watch him in that state was devastating. That's the word that I can apply for what I feel right now. It was devastating because the unknown, even though at this point they're saying strokes, the unknown of where this is, why this happened, where did we go from, it was like so many different emotions all at one time. And so we get the information and, he's getting the medicine. One thing they were really grateful for, although this circumstance was awful, horrible, terrible, devastating, like all the things, the one good thing was that we were at the hospital when it happened. Quick action, paying attention to what he needed, got him the clot-busting medicine that he needed immediately. So the effects of what would have happened if we were home, if I went downstairs for lunch for a minute, if I'd been on the hallway and the phone, if I had fell asleep in the room, would be much different than what they are today.
So let's kind of stop right there, because your attentiveness, was amazing in this situation, and could be accredited, to saving my life. If you was downstairs in the cafeteria, if you were talking on the phone, or just not being, attentive, and it really helped me with my wife. Cause my wife was always attentive to me. I'm like, oh, you be all right. The people got you. No, the people do not always have you. They are not always there. Yeah. And so if you have a family member in the hospital, yes, and you're there with them, this is why people take shifts. Yeah. Being in the hospital, it's important to monitor that family member, and it's a credit. I credit my wife and her monitoring me and being there and seeing what's going on. Why I am where I am now, because it could have been a lot worse. And this is one thing that we say: it could have been another way. Yeah. It could have been way worse. I could have been paralyzed on one side. I could have died. But I'm doing pretty good in spite of the situation, and we'll talk a little bit more about that. So, I knew that when they first brought me back, I knew the good thing was Rhonda talked to me. They might have just brought me back in and just said, okay, he back, he all right. But Rhonda talked to me, and her talking to me, I tried to respond to her. I wanted to say more, but I couldn't. And the fact that, one of the nurses asked me, how'd you know to talk to him? She just was talking. Hey, you okay? And, she greeted me. Hey, Jason, I'm here. Everything's going to be all right. And I just could not respond. And that, call the nurses back in again. They take me back. And now the next place I'm in is I'm in the ICU. When I wake up, back up, I'm in the ICU.
Yeah. And so he didn't have a lot of recollection memory-wise as to what happened like between those times, but they finally get in the room. He's stabilized. Jason is not, I am not, we are not void of love or anything. And so, I was just like, my next thing was, okay, now I'm settled a little bit. I'm going to get all the information that I can get as far as medicines, like what are we doing, where do we go from here? and I had a bit of space to call friends of ours to ask them to pray. I didn't go into much detail. They didn't even need much detail, to be honest. So thank y'all so much, because I just didn't think about it. And like, so I want to take a pause because like for everyone that I did not call, I want to say I'm sorry. It's not malicious, and anybody that knows me, of course, should know this, but I like to say sorry because there were some people that were like, oh, you didn't call us. I literally was just trying to think about like, what needs to happen, all the things with Jason, our family.
Yeah, but you don't need to apologize for that, because, and this is something that we need to talk about. When people are in a traumatic moment, you're doing the best you can.
Yeah.
So her attention and focuses on me. There are certain people, because my mother, my father, our family, she's calling, she's reaching out as well. But when you're in a traumatic moment, you're not thinking about everything. Right. So not just in my case, but in other cases, this is not the time to be getting offended. Yeah. Nobody called me. I'll give you a case in point today. Yeah. I'm getting an MRI today. I'm in the process of making the post that I made earlier. In the process of making the post, and they called me back to get my MRI. Mm-hmm. Well, I get round to my phone and say, well, I was just tagging a few family members, and tell them to put out the post. Mm-hmm. Now, if I didn't tag you, it doesn't mean I don't love you. Right. We don't thinking about that. Yeah. That's not what it is. We have to stop getting offended about things like that. I was just putting a few things out there. They call me, so I'm done with that. So we really have to be considerate of people's heart, what it is, but also listen. You can't make this moment about you. Right. This moment, what's going on in these people's lives that go through traumatic events, that is not about you. And you need to do your best to, one, to not get offended, and two, try to support those who are going through traumatic moments as best as you can.
Right. And so, the process next was what was going on. Jason's right side was definitely affected. His strokes were on the left side of his brain. They explained to us, just a couple of things. They wanted to make sure that his heart was functioning properly, attributing the strokes to more of heart issues than anything else. So it wasn't what we were thinking of before. All the asthma stuff they were talking about, all this stuff, all the symptoms that we had been seeing up and down throughout this whole time were heart function attributed.
Right. So my stuff was heart related. Yeah. Thank God for the doctor who came in and wanted, they're treating me for antibiotics, but wanted to check my heart as well. Right. Because he had a concern that you just were seeing, why is it, why do you develop pneumonia that fast? Right. Well, that issue was because my heart wasn't getting rid of the fluid fast enough. Right. And in this case, it was a lower or reduced ejection fraction. Mm-hmm. So my heart wasn't, so that was the underlying cause. Right. I can't breathe because my heart is not pumping out fluid to the magnitude that it needs to. That was the underlying cause. And I want to say this again: if you're going and you're getting treating, and things continue to pop up. Yep. Things continue to happen. Keep going. Yep. There's something else wrong. Right. And yes, I was one of the main things that bothered me was I was at the hospital. Yeah. So I was like, okay, I'm good. I'm at the hospital, but it happened in the hospital, and I'll talk a little bit about that when we're about to end. That I happened in the hospital. So I'm in ICU. Thank God for the people, our family that came through. My deacon Eddie Gibbs came through. Deacon Sutherland came through. My Bishop Russell came through. My mom, my dad, my children, everyone came through to be there and support and to see us. My goddaughter came through. Yeah.
Dana came. You didn't know it, but Dana came by.
Dana came through. Taisha came through as well.
People that were praying for us and reached out. Fred and Katrina Wilkins, Tamika. I'm sorry. Corey
came through. Yep.
I'm going to get in trouble naming Charmin and Christopher.
The prayer warriors, you know,
They
for us.
They wanted to send us a message and let us know they were praying.
We can't name everybody.
Yeah, we can't name everybody. But again, it's not any slight to anyone. It was just literally like once people started to find out, because I didn't get a chance to call anybody, but everybody know how our community goes. Y'all know what I mean by when I say our community goes. By the time one person heard something, they were calling everybody. Now, for the most part, that was good. So we want to say thank you. But before I could, figure out, think of somebody to call, people that already started calling people. So we didn't have opportunities to call anybody. There were people that were calling me, just saying, hey, we're praying, we need something. And I didn't even know if they knew because...
And listen, in those moments, sometimes a text is all that's needed.
Yeah.
Because you don't have time to answer everybody's phone call.
Right.
In traumatic moments, so you just let people know that you're there.
Mm-hmm.
You're aware. You're praying. You care. You can support with your prayers. You can support financially, however you want to do. But it's too much and it can be overwhelming.
Right.
And sometimes you have to tell your loved one, hey, shut the phone off or whatever. Mm-hmm. People, it's not about being rude or not caring, but they have to take care of themselves in that moment. And I was telling my wife earlier, hey, thank you for everything that you did. You did as much as you can do, but you have to take care of you.
Yeah.
Your husband is being in a traumatic moment, so you can't do everything for everybody.
Yeah.
She did the very best that she could, and I thank her for everything that she did.
You're absolutely welcome. One of my things that I said before, even before Jay had the strokes on that Wednesday, we were in the hospital again. Like I said, we went on a Sunday. And we were there, and I think it might have been either Monday or Tuesday. It seems more recollectedly, it may have been Tuesday night. But as I was in the room with him, they didn't have a bed. They literally had like a bench. And I said, if I have to sleep on the floor, I'm not going to leave you. And my commitment at that point was, this is what better or worse and sickness and health looks like. I love the love and the trips and the gifts and all the things that we're able to do. And all this time that we were able to build, be bonded, learn, and love each other. But at the moment, what he needed from me was a different kind of support. A trip wouldn't have been helping at any point during this time. Money wouldn't have helped him at this time. Gifts wouldn't have helped him at this time. He needed my support in the form of presence and attentiveness. Mm-hmm. And that's what I needed to give him at that time. And I committed at that point. I said, you know what? This is what it looks like. This is what for better or worse looks like. And I was committed to staying there with him to figure out what was going on because I needed answers and somebody was going to give it to me. Once we found out what was going on and we had a prayer focus, we figured, okay, at this point, this is what we know to pray for. This is what we can, decree and declare for his healing at this point. Because up until that point, we had nothing. We were just doing our own, like random kind of surface things going on. And of course, going to doctors because we're not afraid of doctors. We need an answer so we know what to pinpoint. And if you're going through anything, be mindful to focus on what it is. We always say you got to be able to put a name to something. Well, you got to put space to something as well. And at this space and at this time, we need to be able to have a pinpoint for prayer, to ask specifically for prayer during this time for healing for his body, and to find out the answers to the question that we've been trying to ask the whole time of what is going on, what's happening. My love, my adoration, and my respect for this man made me do this because I've said before, to follow Jason because he's my husband isn't enough. That doesn't make any sense to me. Some people just follow people randomly around because they're a spouse. My commitment to him, and I've said it before, this is not my first time saying it, is that my love and attentiveness to him is because, one, he does exactly what it is that he preaches and talks about behind these doors that we live in. All right? So I didn't have to serve him in a way that was like, oh, well, I don't really care because he don't care because, be realistic. If somebody's nasty to you, they're doing all kinds of stuff. Even in sickness, humanity would probably kick in and say, well, they don't be nasty, so that's on them. You know what I mean? Realistically speaking, right? But my point was, everything in every aspect, this man has covered us, prayed for us, encouraged us, given to us, just like all the literal things. And at this moment, How can all the love expelled not be given back to him, especially at during this time? I wanted my husband to get well and come back home. I kept telling them people that. Like, I don't know medical terms, stuff or whatever. I told God this way too. I did not go on my knees to pray. I didn't have the strength to get down. I probably wouldn't have been able to get back up. But I said, you made him. You made him. You know what his assignments are. You know what this life you have given him. I need his body to work the way that you made it. Every organism, every microorganism needs to come together. Your name is the name that we're going to use to apply to all this stuff because your name is above all of these other names. I know they hear it say stroke. Okay, that's fine. But you're still bigger than stroke. You're still bigger than pneumonia. You're still bigger than all the things that you're talking about. And we're going to use medical resources just to aid us, but we believe the healing power is going to come from you. So I need you to fix it. I need to be able to take him back home. I'm not leaving here. And I literally stayed every single night. This isn't like a hotel stay. They're waking up around the clock because he has to have medicine. They have to take his temperature. They have to, do all these things. And every time but one of the nurses had me laughing so bad. She said, every time I come in here to look at him, you looking at me. I said, he'll never be left alone. Never. It was so bad that at one point they were giving him medicine and they were changing. And I was asking them, what is that you're giving him? How much of that is y'all? Why are y'all giving him that like that? And there were sometimes I said, he's not taking that. Another point, you're at the doctor, but you can ask questions. Ask questions.
Advocate for yourself and your loved one.
Don't just take whatever they want to tell you and you just kind of go along with it, or they're just doing stuff. I was all in them people's business. You hear me when I tell you? Because they had my business in the room. So I made it a point to make sure I was asking questions, to learn what they were talking about, to figure out what was going on, so that I could best aid in helping him. Not only through prayer, but just physically, just knowing what's going on. Because you can't just be aloof in the room. You can't just be like, I don't know what's going on or whatever. My kids, my family, my friends, my uncles, like anybody were bringing me clothes, bringing me food, bringing me whatever. Because I was like, I'm just not going to leave. Because again, for that short moment that he did like a different breathing pattern, had I not been there and something happens. Now, I'm not God, so I'm going to pause right there. I'm not saying that to say like, all glory to Ron. I'm not saying that. But what I am saying is that if I were just kind of just dismissive about what was going on, I'll be back, I'm just whatever, then there would have been a missed opportunity, or possibly a missed opportunity to get him the help that he needed, because I would have been thinking about me. So at the point, I said, I'm showering, eating, I ate. Before my people brought me food, I was eating breakfast, lunch, and then at the hospital.
At the hospital.
I wasn't going one place. I think I know that menu right now. I don't even have to ask what they got on the menu because I ate everything. They'd be like, hey, Ronnie, you're back down here again. Yep. I need them to let me know what's going on. And so I'm just really grateful to God for the life that he lived before this point so that I can minister to him. I am thankful to God that even in a bad situation, he still provided a way out. Let me tell you something. That story about having a ram in the bush is special to me because you think, something's happening bad on one side, but he's making provisions for something else on the other side. Mm-hmm. And I'm happy that even though, we're going up one side of the mountain and something else is happening, that we were at a place where we could still have a way made. And so with him being in that hospital, it has been and was at the point absolutely tremendous at that point.
So let's talk about this. After I came, the second time and I'm in ICU, thank God for all those who were there who were praying.
Yes.
Bishop Russell being there praying. Yes. My good friend Pastor Edward Simmons being in the room. He came there and prayed, Yeah. And sometimes when you're visiting people, you don't try to go all the way in.
Right.
But he couldn't help it. And I said, that's the type of stuff I needed. He interceded all the way in. So thank God for Pastor Edward Simmons. But one thing that I decreed and declared in the moment.
Yes. Talk about it.
One thing. Just because when you have an experience doesn't mean that God changed. Right. Just because your circumstance changes doesn't mean that God changed. Mm-hmm. And a lot of times, when our circumstance change and stuff change and our faith dissipates, God is still God regardless. He's still on the throne regardless. So all my years preaching, teaching other people, now I have to lean on all this preaching and teaching and what I put on the inside of myself. Yeah. So two of the things that I declared in the midst of what it was I was going through. One, I'm a miracle.
Yes.
And that's what I told my wife.
Yes, you did.
One, I'm a miracle.
Yes.
All right. It could have been another way, but let me speak over my own life.
Yeah.
And the fact that I survived is a miracle.
Yeah.
But I decreed and declared, one, that I am a miracle. And two, I decreed and declared full recovery.
Yeah.
Full recovery. These are two things, and I ask you guys to pray for me, speak over my life as well. That I'm a miracle and full recovery. Here's the thing. Yeah. Here's the thing. Yeah. What are you going to do when you get in it? Yeah. It's easy to prophesy, preach, to decree and declare while you're out of it. But where's your faith when you get in it? Yeah. That's when what's really on the inside of you is going to come out. And the truth be told, Rhonda will tell you, I was encouraging her for most of the time. Most of the time, I was trying to, hey, baby, it's going to be right. I'm encouraging her, because I saw, her face change, her countenance change. Yeah. I'm trying to lift her up. Yeah. She's there for me, but I was trying to encourage her. But when it happens, what are you going to do? Mm-hmm. So here it is. When I first started my ministry, 2008, we had ministry in the library. And I remember us going through a series called Experiencing God. Mm-hmm. And Experiencing God, it talks about a moment when your faith is going to be tested. What you believe is going to be tested when that moment comes. And it's called a crisis of belief. A crisis of belief. What are you going to do in your crisis? Is your belief going to change? Or are you going to stand on what you believe? And so I stood on the fact that, hey, I still believe God. God is still God. I'm a miracle. In these moments, my friends, we can either go forward and trust God, or we can kind of go back and just let our faith dissipate. Yeah. But I need you to understand, a faith that is not tested can't be trusted. You can't be preaching all this stuff. You can't be saying all this stuff. You can't be saying you believe all this stuff. And when you have your moment, now you're not sure. God has not changed. I know that he's real, period. And let me help you with this. Life happens to us all. Period. Yeah. Just because you're a good person does not mean life won't happen with you. Just because you do right, just because you do this, just because you're connected, just because you're in the church, just because these things happen, doesn't mean life is not going to happen to you. And it's going to rain on the just and the unjust alike. The thing is this is what I need you to understand. And I thought I was going to preach it, but I guess I'm preaching it now. Yea, though I walk through the valley of the shadow of death, thou art with me. For those of us who are believers, you need to understand that no matter what I'm going through, even though I'm in it, he is with me. And you need to understand that just because you're having trouble doesn't mean God isn't with you. Just because you're going through this marital issue, just because you're going through this financial issue, and I know how we go. I'm a good person. Why is this happening? I give my all. Why is this happening? Just because, God, why would you allow this to happen to me? And so living all kind of life. They're not having any type of trouble. Why are you allowing it to happen to me? Life happens to us all. But what I understand, and I want you to understand, is that he is with you. And many times folk fall away from the faith because something happened. Yeah. And they feel like if God was for you, it wouldn't happen. But I need you to understand that he's a keeper. He don't mean that every valley is going to be removed, but he'll take you through the valley. Doesn't mean that every mountain going to be removed. He'll take you over the mountain. So I need us to understand that. And it's a testimony that I want you to give to you guys. Life is going to happen to everybody. Please understand this, because I know some people think that nothing should happen. Why am I going through this? Why this happen? I know it. I know that, okay? But I need you to understand that He is with us. Where in the world was God in all of this? Where was He in all of this? Okay,
Right,
it could have been a different way.
Yeah.
It could have happened not in the hospital.
Right.
In these type of situations, time is brain.
Yeah, they kept saying that.
Time is brain. Okay? It could have happened and nobody knew it happened. And, it could have happened and I had to take EMS to the hospital. It happened in the hospital. And I'm saying, Lord, I did everything I could do. I'm in the hospital and this still happened. Well, let me look at it through a different lens. Yeah. At least I was in the hospital. Okay? And I'm thankful to God my wife was watching me. She said, baby, I always joke with her, and I said, no insurance money yet. She said, I don't want the insurance money. I want my husband.
Absolutely.
I want my husband,
Absolutely.
And so, she was attentive. Okay, that's another miracle. Well, by the grace of God, old Jason D. King right across from the nursing station.
Yeah.
Nobody had to run down the hall. They was right there. That's another miracle. God is with me there. While I'm in the ICU, I met someone, who was taking care of me, who was healed from a traumatic incident himself.
Yes, and stopped to pray.
Stopped to pray for me because he was a believer.
A doctor.
Okay, that's a miracle.
Yes.
In the ICU. Okay, and then so we were in the ICU. Mm-hmm. What else? What other we want to talk about miracle wise?
So he's in the room. I told you he had 2 strokes one day. We don't know what's going on. He is super weak. He's not very cognitively aware of all the things that's going on, even though he had like moments of clarity. That's on Wednesday. Friday, Jason was up walking. He's walking the hallway. He's talking. His speech was clearly, different because of his facial dysplasia. However, he was up walking on Friday. And the teams, at this time he had cardiologist team, neurology team, his regular doctors. Like, there were people all over the place. We all, literally all day long, we would be seeing people come in the room. They're asking questions. And for the most part, like when they would come in, even from the stroke, they had a stroke team come in as well. They would say, we're looking at the chart and we were expecting something completely different. Mm-hmm. That was a miracle in of itself. To hear people like, we have strokes day in and day out. Every week, every month, we see patients all the time. And based on what your paper says, you should not be doing this. You should not be saying this. You should not be, it was just overwhelming for them to keep saying this because, like, in my mind, I was thinking, this happened, but it's not so bad. He's doing good. That's just a wife standpoint because I'm looking for the best parts of the things that's going on in a bad situation. But to hear professionals say, this is not the result that we should have based on what the diagnosis has been. Mm-hmm. Gave me even more encouraging to say that Jason kept saying he is a miracle and full recovery. There were times that he'd look at me and say, babe, don't worry. I was trying not to worry. I don't even know what that would appear, what we would call like trying to be strong or whatever that would be like. And I just let myself have it. I said, you know what? Let me just stop. I have to pause for a second. Let me feel all that I'm feeling so that I can reset and then get back to give him what he needs and the real support. Because at the time, I wasn't aware. I was so much in go mode of, how are we going to do this? I didn't allow myself to feel all the feelings that I was feeling at the point. But I'm going to tell you what, to hear those people say what they were saying every day. Once he got up walking, if they asked him to do one thing, Jay was doing 3, like literally. They took him down the hallway. It would come to weekend. Next thing you know, my daughter, who also came by the Friday, she was there. She said, I'm not leaving my dad. I'm staying with y'all too. So Jaden was there. She was like, I'm not leaving my dad. Now, Jaden, who we affectionately call Muffin, she was there the entire time. Miss Bam said, I don't care if you say that's your husband, but that's my daddy. I'm not going anywhere.
I had 2 attendants at that time.
So at this point, because Jaden is CNA certified, she was like, Mom, I'm going to be here to help you as well. So Jaden came there to help. And I'm going to tell you what, we became physical therapists, occupational therapists, speech therapists, nurses, nurse assistants. We became all the things because we were literally absorbing all the information that they were having. And when Jay was ready, we had to go. We were putting safety belts on him, walking up the hallway. At this point, people were getting so used to us walking, oh, there go Mr. King again, because he would be up. And I have one story to tell you. We were up, Jay was in there, and at this point, he's having to have assistance to get up. He was still a little weak, but he was still declaring strength from his mouth. His body was weak, but he just would not stop saying and declaring he was doing good. He got up to use the restroom, and of course, every move that he did, I'm like, okay, what's going on? So he got to use the restroom, and when he got up, he said, I'm ready to walk. I looked up at the clock, because I didn't know what time it was. I just knew it was like, well, it's got to be late. I looked at the clock. It was after 1. So I told Jay, I said, babe, it's after 1. He said to me, I know. I know that meant, I don't care. I know that meant, come on, let's go. My daughter looked at me. We got up after 1 o'clock, walking the halls of the hospital. As we were walking, with the safety belt on, making sure he was good, like we are, again, the therapists, all of them. As he was walking, he kept saying, I'm a miracle. Full recovery. And his steps were a little slow at first, and then they would increase. So much so that at one point he wanted to walk backwards. Let me see if I can make sure I have enough energy to walk backwards. Then he wanted to turn around, and then the walks became longer. He would not allow them to put him in a wheelchair. Thankful and so grateful to God, he never had to use a cane. He never had to use a walker. Mm-hmm. They come in there and say things. What is this? He said a clock. They want to know if he was aware. And at this point, his awareness became to be, excellent. He was just really aware. Who was that sitting next to you? What is that? What are you lying on? He just increased better and better. And it's like the more he said it, it's almost like him saying I'm a miracle and full coverage was activating his body to do what his brain couldn't tell him to do. All right, literally. So we were watching the process of healing literally in real time. This is how everything was going at this point. And so again, even with that, they were like, what is this guy doing? Stroke people are coming in and they're like, and what side was it again? Because his right side again was the most that was affected. Jay could not open his hand. It was fully closed and tight. He could not, raise his arm to a certain level. He had to pause between sentences.
Yeah, my hand was kind of like this most of the time.
It was worse than that.
Yeah, very tight, but I can flex it. I can flex it now, but I could not. It was like
that's a miracle. He could not do it.
And I'm still in rehab. We'll talk about the rehab as well, but that's something else.
Yep. Yeah. So he stayed at the hospital. They were expecting him to stay there for a very long time. Again, we never got an end date. They never talked about discharge dates because of what they were looking at, and just they wanted to make sure medicines were doing what they were supposed to do. They wanted to make sure that he was stabilized, and so we were just literally day to day just waiting to see what they're going to say next, because every time that one team would come in, they'd bring somebody else in. They'd have another assessment. They need another battery of testing, another blood panel, they just kept doing all things, but I was okay with that because he was still here. He was still, all those things that they were doing was just solidifying the healing power and that everything's going to be okay, and it'll get back to where it needs to get at time. But Jay surpassed that. He was discharged way earlier than they expected. We were literally looking up to maybe a month or so in the hospital. That didn't happen. They discharged him with rehab, and I thought, initially, he's going to be in rehab. Oh, we'll get to take him back and forth. Well, they informed me, no. This is not an outpatient deal. He's going to have to be admitted. Mm-hmm. No problem. We're staying. He got to the rehab, and they were like, well, he's going to be here, maybe 2 weeks or so, 10 to 14 days.
10 to 14 days.
To come here, and we got there, and again, God's way of showing that he's there with us. We got there. When we got in the lobby, the receptionist there hadn't spoke to her, hadn't given her any information. She said, can I give you a hug? I said, absolutely. She said, I feel like I need to pray for your strength. She did so. Didn't know me. I'd never lived away from anywhere else. It's unconventional to have somebody in the professional just get up and pray. Like at this point, we've had doctors praying. We got the CNA praying. We got the nurses praying. And this lady that I don't know, that Jason does not know, is offering to pray because she sensed a depletion, a weariness, and she did that, and I was very grateful for that. But then she asks, "Where's the patient?" I'm pointing at Jamie because the patient is over there. He got to get admitted, and she again started witnessing and testifying of the goodness of God. So we're like, okay, God is still here with us. We get to the room. We don't say anything. Jay has a roommate when we get there. We get all settled in. This man, again, we don't know him. He doesn't know us. Says through the division of the room, "What do you preach?" Didn't say one word. Jay did not come in again. He's not speaking that well. We're trying to get him settled. We're not doing all things. My daughter and I were in there sanitizing the room that they said was already clean. We were doing all kinds of stuff in there. Right? We were doing all kinds of stuff in there. But he said, "What do you preach?" And Jay looked at me and, went to communicating, to him, like, this man is asking me, did I preach? And I didn't even say anything. But he was discharged, prayed for Jason on his way out, decreed and declared some things. For him. And again, it's like every step that we went through, even though, again, it was not ideal by a long shot, was letting us know, I am still here. Mm-hmm. And you asked the question earlier, where is God and all that? He was right there.
Right.
Like the whole time, like literally, people say that, but we were seeing evidence of God being with us every single place that we went.
Let me say this, because, one thing that I remember is, and I've preached on it before, my mom had that poem, Footprints, in the house. Yeah. That, there was 2 sets of footprints walking. Yeah. And then, all of a sudden it's one set, and the person thought that God left them. Mm. But the issue is it was God that was the one carrying them. Mm-hmm. And even somebody on tonight, you watching us, you say, well, where's God in it? Mm-hmm. And we're trying to tell you in the midst of my story. Yeah. Different places we say, hey, God is still in it. God is still with us. God is still carrying, me in the midst of what it is I'm going through. Yeah. And, everything that you go through, and you're a believer, understand that, you can't quit in the middle of it. You can't quit because it didn't go your way. You can't give up because it wasn't the outcome you wanted to. This is a physical ailment. Yes, it bothered me in the hospital. I had a moment now when I shared, maybe about 15 minutes, put some tears in, Yeah. Now, then I snapped back. And let me tell some of y'all right now, it's time for y'all to snap back. Yeah. All this crying, all this complaining. I had 2 strokes and a heart condition, and I'm still giving God praise. Yeah. But all this crying, complaining, your faith depleted, I don't know where God is. It could be another way. It could be worse. Yeah. Snap back. It's time for some of y'all to snap back. Snap your faith back, your praise back, your worship back. It's time for some of y'all to snap back, into your relationship and your faith with God. Again, I remind you, life happens to us all. Yeah. Just because you're a good person doesn't mean that bad things or difficult things won't happen to you. But you have to still give God the praise. I wanted to be in my report when I'm fully recovered in a couple of months or next year. I wanted to be in my report that I didn't turn my back on God. Yeah. I wanted to be in my heavenly report, that I still trusted God. I want that stuff to be in my heavenly report. And some of you guys need to snap back, get yourself together, and still listen. God is in it, and it's not the first thing that you've been through. Yeah. And the same God that brought you out of the difficult situation will bring you out of this difficult situation. I am believing. Yeah. And this is why I'm on live. My mouth is a little twisted from the stroke. My hand is not where it needs to be. Yeah. But I want you to go ahead and see it now. So when I snap back, you remember. I'm not hiding when I snap back. That's a word right there. Snap back. I'm not hiding what happened to me because I want to be a testimony. All right. And for many of us, God wants you to be a testimony, but you got to pass the test.
Yeah.
So I'm telling somebody, on tonight, you have to pass the test. You got plenty of time. Don't just quit in the middle of the test. You got to pass the test so you can give your testimony to somebody else, to be an encouragement to somebody else, and at the end of the day, God be glorified.
Amen. That's what we got to say. He got to be glorified in this, because who looks for, who declares, and who waits for the manifestation of healing?
Right.
Jason King. Jason King.
Listen, I'm going to talk about it. Listen, when I'm preaching, teaching, this is not nothing that, I'm just saying because it sounds good.
Right.
I mean, I'm not a jokey preacher. I believe this for myself. And and there are plenty of people, God encouraged me as well. I met people that said, hey, I recovered fully from a stroke.
Yes.
It'll come back. Your face will come back.
Yeah.
Your right side will come back. I'm already stronger on the right side.
Yeah.
I'm already talking better
in a big way
than I was when it first happened. So I'm just going, here it is, through the process.
Yeah.
I'm just going through the healing process. Yeah. I'm just going through the recovery process. And guess what? One, you have to speak over yourself, okay? And it's a mind thing. And I knew that when my wife was talking, I knew that you have to walk. You have to get up. You can't just stay in the bed. Yeah. You just can't wait for the people to come get you. I knew that you have to walk. Yeah. And you have to have the mindset that you can get over whatever it is you're dealing with. You have to have the mindset that you are going to come out. Not, well, we'll see, and if the Lord will. No, you have to have the mindset that you're going to come out, that you're going to get better, okay? And I know everything doesn't happen the same way for everybody.
That's true.
I know some people get healed on the other side. I understand that. Yeah. But I'm believing God for my life at this moment. Hey, I have the mindset to be well. So I spoke, and I had the mindset, let me get up out of this bed. Yeah. I'm a worker. Okay? I'm a worker. I'm a believer. Let me get up out of this bed. Let me walk. Let me walk backwards. Let me dance while I walk it. Let me do all this stuff. Yeah. Because I'm just not going to sit here. This is going to defy the dogs. And Rhonda's right. We come to the rehab, and the person said, where the patient at? I'm the patient. I didn't look like what I went through.
Literally.
I wasn't speaking what I went through.
Literally.
All right? I wasn't thinking what I went through. Where's the patient? I'm here, and what was supposed to take 10 to 14 days.
Thank you, Lord.
We was out of there 4 days.
Yeah. Thank you, Lord.
I was out of there, out of the rehab facility in 4 days.
Yes.
There's a miracle in that. There's God in that. Now, guess what? I still had to go through it. Yeah. But how am I going to go through it? Yeah. How are you going to go through it? Yeah. My issues are stroke. Somebody right now, you're struggling in the marriage area. Somebody's struggling with God. What's going to happen with my business? Yeah. What's going to happen with my job? Somebody has an issue going on with your children. Okay? But you have to go through the process, whatever that is. You have to believe. Yeah. Okay? And there are many things. The job of the enemy is to whisper in your ear. Yeah. And have you feel like God's not going to show up for you. Like God doesn't care about you. Yeah. Okay? That's his job. Okay? That you by yourself. But the devil is a liar. Yeah. All right? You are not by yourself. He is with you. And we need to go through the process. Yeah. And so I'm 2 months, 2 months since this incident happened.
Today.
And many people don't understand I'm at rehab. So I go to rehab, twice a week, and I got occupational therapists, speech therapists, and physical therapists.
Some appointments last like 4 hours of the day. The other day we were gone literally all day long. From 8 o'clock in the morning, we got home to almost 5 o'clock. So appointments, again, not trying to be funny and super strong. That's a little weary. But I'm going to tell you what, I'd rather be at appointments for 5 hours, 8 hours, 10 hours than to be somewhere else for 4 hours. To not have this man back at this house in our dwelling and not going to appointments. So
Thank God for our friends, the Jordans. Latanya Jordan, who is kicking Kansas butt. She curses in hers, but I don't
Yes.
say it. Kicking Kansas butt. But Brother Keith came and visited me in the rehab facility, and I was gone.
He wasn't there.
I was supposed to be there, but I was gone. So I'm thankful. My mom and my dad being there, visiting me, my brothers and sisters being there, visiting me.
Well, Sheeta was the first person on our family to come. So
Okay.
Bernard was there.
Yep. Moderator Bernard Brown, my uncle, was there. So many people was there supporting us. But I just wanted to. I'm going to put some videos in this stream as well.
Yeah.
Just kind of rehab. I may put. I'll see what I can put in. Jay's going to put a whole reel together for me for my recovery. But so I'm still in recovery, doing real good. And we're going to end this live because we're an hour in. But I'm still in recovery.
Yeah.
One reason I decided to go live as well, because many people say, well, I didn't know what was going on. Some people I ran into, I didn't know. How can I help?
Say that now.
How can I help? What can I do? So that's one of the reasons as well. I definitely want to be a testimony, but for those of you who wanted to help, I'll put a link down there. One thing that's really helped us was those that bought food for us.
Yeah.
Especially we at hospital all day long. My wife is a cook, but sometimes that's draining. She's my driver. They won't let me drive. She won't let me drive either. Y'all know I'm saying, hey, I can drive.
I'm looking now. I hadn't seen some of the stuff. I'm looking at some of the things now.
What's that?
Tanya put, I rung the bell and came straight to see you. And that's our friend. She was diagnosed, our friend and sister was diagnosed with stage 3 breast cancer. Mm-hmm. Amazing neighbor, amazing friend, and amazing family member at this point. That's just the bottom line. Mm-hmm. And she has done amazing, but they were here. Mm-hmm. This baby came from ringing the bell and came straight here to go check on Jason. Mm-hmm. We were like, girl, tired and everything. So, even in your prayer, we are asking you to pray for us, but also, look, say Latanya's name, say Keith's name, that's her husband. She's going through, but he's going through. He's been a tremendous support for her, their family, all the things. And she hasn't made what she's going through deter her from still being a friend. So
another fighter.
She
a Dallas Cowboy fighter.
We love her. We don't love them Cowboys. We love her. But she's just been really good and great encouragement as well. Oops, I'm losing this now.
Okay.
To us as well, because even in going through her own things, she literally says from her mouth, she's making sure that she's okay. She has a moment she's admitted, but she's staying positive and doing what we're doing and decreeing and declare what her health will look like, what her future will look like. You can't let things just kind of let you down and get you down, because this has been a long road.
So give your testimony, and that's what I'm doing tonight. I guess this is my platform. This is my pulpit on tonight, our pulpit. Yeah. I was thinking, preachers are always in preacher mode, thinking about something, how you can preach something, how you can spin something, and I was thinking, I'm going to use this and I preach this here, there, but I think tonight was the night, to somewhat, give that platform that no matter what you're going through, God is with you. Not that you can't go through anything, but God is with you. We're going to, go ahead.
Okay. So, again, for us having the first video in 2 months, like I said, generally speaking, now Jay is on Facebook way more than me. Y'all know that, right? But because we were focusing on the healing process and not just posting to let people know, this is why we've waited for this long. So again, we said that today is 2 months since this happened. We didn't put any, subliminal close, please pray. We didn't do any of this stuff before that. It's just now, because now as more people are starting to know, and ask questions like, hey, we didn't know, you didn't tell us, how can we do whatever? We decided that we go ahead and do it. We didn't want to put a post, some people are asking. Most people just reached out to us once they found out. But since now that they know and we'll make it easier, we just said, well, we'll just do it this way, to let everybody know what's going on, what happened, how we got here, and then more importantly, how we're doing at this point. And again, we're watching and we have seen God's healing power throughout this. We know that we'll continue to see his healing power through all of this stuff. But Jay has, something that he's pinned there. And if you'd like to, I want to say thank you in advance, just for being on and engaging with us. I want to say thank you. Sometimes people go in automatically as a victim and me and what can I do, and automatically go to I need and can you please and all that stuff. And so we want to say thank you so very much. Jay is going to post a meal train. Think somebody else, Tanya, we got that information from her.
Yeah.
People were asking how they would do it. This is just an easy way to do it. So, you can see, I think, what somebody else has done. So we're not having like people do it on the same day, the same time or whatever.
Yeah.
It just makes everything easy. It is definitely, it's been more than a blessing in any capacity. People have prayed, they have given, they have just came by to see, they have done whatever it is. It doesn't have to be any particular way of support, but we want to just say thank you. We want to say thank you for everything up to this point. And so if he's doing this good at 2 months,
man.
4 months we gonna report it. 6 months we gonna report it.
Yeah.
We've been video chronicling everything that he's done since he started. And when you begin and when we share that reel, you'll see what I mean. Because again, we can say that, and to look at his physical present now, though in the state that it's in, if you saw where this started, why we're here. Giving God praise.
Deacon Gates, he's seen it from being in the ICU. He was there. And a few people. Deacon Gates was there, and then he came in the hospital. Maybe a week later or so before I just started. But it wasn't even a week.
So much time.
But he saw how far I recovered. I was able to give him a hug.
Yeah.
During that. So I've recovered well. But many people ask how can they help.
Yeah.
And many people already have.
Thank you so very much. In whatever capacity. Thank you so much.
They already have. So what can we do? They wanted to give us a meal and things of that nature. So I pinned it for the meal train.
Mm-hmm.
If you want to give us a meal, it has our favorite restaurants. Walmart. If you want to do us Walmart, we shop at Walmart mostly.
Yeah.
Food Line is a second for groceries. Whatever it is, we're putting it out there. We didn't rush out. Hey, we need this, we need that.
No.
But people have been asking us. People have been kind to us. And we are grateful. We are thankful. I'm not back to work yet. And so anything that, God lays on your heart to do, we're thankful.
Yeah.
We're thankful. We're going to be all right regardless.
Right.
We trust God, but he does use people.
Yeah.
He does use people. So we are thankful for those who are letting God use them to help us in this way.
Yeah.
I'm not used to this. I'm a man. I'm used to working, taking care of my family, helping other people. But sometimes we have to, if there's pride, let go our pride. Mm-hmm. And when people want to help, one of my classmates called me. He said, I didn't know.
Yeah.
Someone else, I didn't know. So now I'm putting it out there, just giving people information. My meal train, Cash App, Zelle, I think, and PayPal. Any way you want to help, we greatly appreciate it. And we thank God for you helping. Any final words before we close? You want to?
I got a couple final words.
Okay.
So again, thank you. The two biggest, smallest words put together. I want to say thank you. That is our heart, expression to all of you. Again, for engaging us, praying for us, whatever capacity that I want to say thank you. And I want to say, we'll actually put it on something because this is our declaration. But my declaration through all of this is, I know what prayer can do. Mm-hmm. And for Jason, I am what prayer can do. He is definitely what prayer can do. And so we love you guys.
I want to say this because, like I said, God, he uses people.
Yeah.
And I'm thankful. The day that I got out of rehab, my air conditioner went out.
Oh.
Our air conditioner went out.
I forgot about that.
Thank God for, our friend Sherelle Edie.
Thank
from
you.
Edie's Maintenance came and took care of us, saw about the issue and took care of us.
Thank you so much.
And I was always sharing his stuff, Edie's Maintenance, because he does great work.
I'm
thankful for that. And before we went this, I was in the process. I bought a new for the sink. Faucet, yeah. For the sink because it started leaking.
Yeah.
And our good friend Steve, his
Thank you, Steve. I forgot about that. That's right.
Calvert Myers.
Yeah.
But our good friend Steve, he's our handy guy Meaning, if I can't do it, then I
Yeah.
call Steve, and you know he
And
came
to do it.
and took care of us, you know,
Yeah,
in
he
our
came to do
moment of need. So thank you, everyone, for your prayers and your support. I'm tuning up a little bit. You know, I'm not doing too much.
Yeah,
You know,
because he gets tired. I know after this he'll probably be tired because he's talked now for over an hour. But
Yeah.
we're just focusing on doctor's appointments again every week, several times a week. We're at doctors
Yeah,
literally from
yeah.
morning to afternoon.
So now I'm a heart patient, a stroke patient, still seeing a physical therapist,
Yeah.
an MRI. Hey, take this genetic test. I just finished wearing a
Yeah.
heart monitor for a
30
month,
days. Yeah.
but I'm still good. I'm just going through the process. All right.
Yeah.
We love y'all. We appreciate y'all. We just want to make because there's so many people that care about us, and we appreciate it.
Yeah.
So you know, we finally just kind of wanted to put it out there and say thank you, and you know, just thank you for all you've done, and also give you people an opportunity to help that want to help.
Okay,
All right.
that's it.
You good?
Y'all have a good night. Again, we love you, and we hope to speak and see you guys soon.
And listen, may the blessing of the Lord be upon your life. Have a good evening. Appreciate you.